Hello and welcome. My name is Jeannie Luciano. I am the Senior Manager for Stroke for Get With the Guidelines and at the American Heart Association. I want to welcome you to our webinar for the Get With the Guidelines hospitals to share with you information about an exciting new tool for stroke patients and caregivers that has been developed under the Getting to the Heart of Stroke initiative, which has been supported nationally by the HCA Healthcare and the HCA Healthcare Foundation. We believe this tool could be a valuable one for your stroke patients and their families, and a value add for your hospitals too. Participating in this app is free. It is for both hospitals and patients, and is optional for Get With the Guidelines hospital, but we really do see it as an added value. During today's webinar, we will have some introductory remarks about why this new tool was developed from Russell Harper, the Assistant Vice President of Neuroscience at HCA Healthcare. Then you will receive an overview of this tool and its functionalities from Stephanie Mull, the National Vice President of the American Stroke Association, a division of the American Heart Association. Then Dr. Allison Bailey, a Physician Director of Cardiovascular Disease for HCA Healthcare, whose hospital was involved in the beta testing for the Stroke Helper tool last year, is going to share some insights and best practices for enrolling stroke patients and their family caregivers in the tool. Finally, we will close by answering as many of your questions as we can. You will have the opportunity to submit text questions by typing them into the questions pane of the control panel. You may send your questions at any time during the presentation. We will collect these and address them during our Q&A session at the end of today's presentation. Before we get started, I'd like to go over a few housekeeping items so you know how to participate in today's event. The webinar is being recorded and will be sent via email within 24 hours of completion. There are no CEs associated with this webinar, but you may access a certificate of completion in your follow-up email after the conclusion of the event. If you do tend to experience any technical issues during the presentation, most of these can be resolved by refreshing your browser. If your issue is not resolved following the refresh, please refer to the GoToWebinar customer service team, whose contact information can be found in your webinar confirmation email. Your handouts, you will see there are multiple handouts for you that are in the handout section of your control panel as well. As we get started, I first want to introduce you to Russell Harper, the Assistant Vice President of Neuroscience at HCA Healthcare, for some introductory remarks. Russ, the floor is yours.
Jeannie, thank you very much. I appreciate it, and glad to be here today. So, again, my name is Russ Harper, AVP of Neuroscience, and we were a part, just a couple of brief things that then we'll get rolling, but we were a part of, HCA was a part of the stroke self-management tool in our work with getting to the heart of stroke. This is an initiative that HCA and American Heart Association together, what we're looking to do is take the brain and the heart and have that connection help us with identifying etiology and having a better plan at discharge. So for patients on the clinical side, but there's also professional education components of that. And there's also public education, which is really where the stroke self-management tool comes in. And so I think it's important to start with the why always. And so as we look at why this is so important, 1 in 4 strokes is actually a recurrent stroke. It's probably information that you're very familiar with, but sometimes we need to be reminded of that. And 80% of these recurrent strokes may be prevented through tailored prevention plans, education, lifestyle. You're going to see how this tool will help fit into that. It's also for stroke, not just for stroke survivors, but for family caregivers to help offer support so that they can have the education that they need to be a part of the care for their patient, for their loved one. So let's go to the next slide. Here we go. The world's changing, right? It's a changing population. It's you know, the technology is changing over time, and we need to do something to meet a younger and a more diverse patient. And really, as we look at stroke, we know the stroke prevalence is highest among people of color, and we also know that stroke prevalence has increased among younger adults. So I think it's important here, I'm going to call on Dr. Bailey for just a second. Comments on that, and even the first couple of points as far as recurrent strokes and what you're seeing, because I think it's important to hear from a cardiology perspective.
Yeah, no, thank you, Russ. And you're probably wondering why a cardiologist is on a stroke webinar. But I think that's one of the great things about this initiative. We really have tried to go across sort of our traditional roles and make sure that we really are recognizing etiology of stroke and making sure that there aren't reasons someone's going to have a recurrent stroke, and that we haven't addressed those. So that's really why cardiology is involved. This whole collaborative is based on improving the care of patients and bringing in all members of the team that can be helpful to do that. And like Russ said, we know that stroke prevalence is high and that it's increasing in younger people. So that makes us, even more interested in trying to make sure that we prevent not only that first stroke with education, but particularly the second or the third stroke. Thank you.
Dr. Bailey, thank you. And so the last point I want to make is that the American Stroke Association did a marketplace assessment, and there's not a tool, right? They found that there's not an evidence-based tool to really help with stroke patients and stroke caregivers to manage their care, to provide them the resources they need, the education they need to make a difference. And so hope you're excited and interested to learn about the tool. I'm going to turn it over to Stephanie, who's going to share a little bit more about the stroke self-management tool.
Thank you so much, Russ, and thank you, Dr. Bailey, for joining us on the call today. And I am delighted to also be with you to provide you with an overview of our solution to the problems that Russ and Dr. Bailey just recently outlined. So our solution is called Heart and Stroke Helper, and I'm specifically going to be talking to you about the stroke journey portion of this new tool that we're excited to launch nationally. So the real goal of this tool and why we feel it's so valuable is that a lot of times today, well, first of all, you all know as stroke coordinators and people who are caring for stroke survivors in their acute journey that it is an incredibly overwhelming time in the lives of not only the stroke patient themselves, but also for their family members as well. Nobody expects to have a stroke and then out of the blue, one strikes and leads to lots of questions and confusion and anxiety. And so part of our goal is to help reduce and address some of that by giving them a tool, hopefully during their hospital stay or shortly thereafter, that provides them with information that they may not even know that they need, and to meet them where they are with this tool. So our goal is to translate a lot of the evidence-based recommendations from our guidelines that you all are so familiar with into actionable, understandable information that's at the patient's or their caregivers' fingertips. And we hope that by doing that, we can also elevate shared decision-making between patients and families and their healthcare team, and deliver to them the patient education that they need to empower them to drive behavior change. And as you'll see, the whole app was developed with behavior change theory in mind, so that we, hopefully the app serves as a partner to them to help them make those behavior changes. And so you're seeing a snapshot of what the tool looks like. Just a little bit of background. So Heart and Stroke Helper is built on a platform developed by the American Heart Association. And there's actually 4 different journeys available within Heart and Stroke Helper. There's a heart failure journey that is just now being incorporated. There used to be a separate app that some of you may have heard about called the Heart Failure Helper app. And so we are incorporating the Heart Failure Helper into Heart and Stroke Helper. That transition is occurring now. And so there's a heart failure journey. There's also already a cholesterol journey available, and there will shortly be a self-managed blood pressure journey as well. And then, of course, we're here today to talk about the stroke journey version of the tool. They're all accessed in the same way as you'll see me talk about. So just a little bit of an overview of the Stroke Helper patient journey. The app itself can be used, as I said, from the beginning of the patient's acute care event all the way through stroke as a chronic condition. There is a approximately 13-week educational journey, but even after the 13 weeks, they can continue to go back and reference that education and continue to use some of the tracking functions of the app that I'm going to be sharing with you about. But you'll see that we want to take patients or users of the app on a journey from starting out with their event to education and goal setting. We know goal setting is an incredibly important part of the recovery process for many stroke survivors, as well as action as well. So ultimately, of course, our goal is to improve patient outcomes. So who is eligible for enrollment? We have, first of all, you do need to be 18 or older to be a user of the app. This app was not designed or intended for pediatric stroke patients or for the parents of pediatric stroke patients. We do, however, think it's valuable not only for patients themselves, but also for their caregivers. And it's also appropriate for all types of stroke patients, ischemic, hemorrhagic, as well as those who experience a transient ischemic attack. Our goal is to enroll as many patients and caregivers as possible and as appropriate in the early days following their stroke. And as you heard Jeannie say at the very beginning, enrollment in the app is free. So here are a couple of images from the home screen of the app. We tried to make it as simple and user-friendly as possible. So, the thumbs up, thumbs down iconography is hopefully readily understandable. And as you're going to hear from Dr. Bailey, we've spent an entire year beta testing the app and receiving feedback so that we could make it as valuable and user-friendly as possible for stroke patients and or their family caregivers. So you can see on here some of the functionalities that are available from the patient's home screen. They can indicate whether or not they've taken their medications, and really simple for them to add their medications by clicking on the little plus button. And then as they start typing in their medication, it will bring up choices based on the letters that they're typing. And then after they've entered their medications, on a daily basis, if they don't take their medication, they will receive a reminder within the app if they have not chosen or haven't given a thumbs up. So it's a really helpful reminder tool as well. They also have the ability to track their food choices and to indicate whether they are making healthy food choices on a particular day. They have the ability to track physical activity and to enter physical activity. And then they also have the opportunity to enter sleep and mindfulness information, vital signs. Certainly blood pressure is a particularly important vital sign for many stroke survivors. And so they have the ability to track blood pressure if they wish, and they can also track symptoms and lab values. And then finally, at the bottom of the screen, there is what we call knowledge bites. And those are rotating bits of information that they can also view when they open their home screen. There is also a very robust amount of educational content available through the app. And so on the lower left corner here, where the arrow is pointing, you can see by clicking on this little to-do list icon, that will bring up that day's educational information. And as I said, so this to the left is an image of what their educational content might look like. We started out very basic in the first week with information about what a stroke is, what the different types of strokes are. We talk about the warning signs of stroke because we know they're at particularly high risk of having a recurrent stroke in that those early days and weeks. And so just sort of that really basic information. And then each week progresses with additional information about, week 2, it focused on rehabilitation, why rehabilitation early on is so important to take advantage of that period of neuroplasticity. but also why it's important on an ongoing basis, and then progress into content about healthy eating, physical activity and physical changes they might be experiencing, the emotional and cognitive changes after stroke, the contribution of stress, medications that they may be prescribed and why different types of medications are important. There's information from the American Stroke Association about tips for daily living and how to overcome some of the financial challenges. So you can see just a robust amount of education, all that you can be confident comes from the American Stroke Association and is evidence-based information. So we can know that our patients are receiving high quality education through the tool. There are some other functionalities as well that I just wanted to highlight briefly. Users do have the ability to earn badges if they are regularly indicating that they're taking their medication or tracking their vital signs, blood pressure, etc. They also have the ability to connect a health device with the app so that it will populate the information for them. So for example, if you're using a Fitbit to track your physical activity, you could connect your Fitbit to the app and you'll be able to see that progress in the physical activity portion of the app. Also, if you're using a blood pressure monitor that has Bluetooth, likewise, you can track blood pressure or connect your blood pressure device to the tool. There is also a connection here under the profile to our online patient support network. We know how important support is to survivors as well as to caregivers, and so it's an easy way for them to connect to the stroke community in our AHA and ASA support network. A few other functionalities I wanted to call out. One that I think is particularly valuable is this chat function in the upper right corner of the home screen. By clicking on that chat button, you can enter in some words or phrases or questions, and it will pull from the educational content within the app to answer the question. So again, don't need to wait for the education to appear, but if you have a particular question, that can be valuable, and it can actually even be a valuable tool for those of you who are at the patient bedside to show to your patients. And then finally, there's the ability for users to generate a custom PDF report that they can then share with their healthcare professionals. And you can generate that report by clicking on the little file folder icon, and then they can choose what information from the app they want to include in the report. Maybe they want to include their blood pressure information, but not their weight information, so they can customize their report and then generate a PDF to share. So how do you access the Heart and Stroke Helper? It is now available in both the Google Play and Apple App Stores, and you can find it in your store by searching for Heart and Stroke Helper. And then you will download the app and install it just like you do any other app you might have on your smartphone. And as part of the registration process, we try to keep the registration process very short. So there are just a few questions that you will be asked in order to register for the app. One of the key questions, though, that you will be asked is what condition you're interested in as part of your health journey. And so you will be choosing stroke, presumably, if that is in fact the condition that you're interested in, or your stroke patients, of course, would want to choose stroke. And that's a really important point to emphasize, because it's by choosing your health journey that you receive the customized education that will be specific to stroke education. I also did want to highlight that we have set up an email address for you and others. If you have any questions or comments for us, or maybe you need a little bit of technical assistance related to Heart and Stroke Helper, you can email helperapp@heart.org, and we are monitoring that email address inbox on a daily basis, Mondays through Fridays. I also wanted to talk about the opportunity that you have as hospitals to have your hospital system name and hospital name displayed within the app. So as you can see here, there's just an example of, HCA healthcare system. As part of the app, will be a drop-down menu where you can choose your health system. If you're part of a health system already, you can choose that. And there's already a number of health systems already within the app. If you don't see your health system when you register, you'll have the opportunity to add your healthcare system as well as your hospital name. Doing this is completely optional, but the value in doing it is that it just allows your patient to stay connected, if you will, to your hospital system. And of course, they can also enter in their patient information, or their doctor's information as well. Alrighty, so I am now going to turn things over to Dr. Bailey to talk about lessons learned from beta testing, and there we go. So Dr. Bailey, turn it over to you.
Excellent. Thank you so much, Stephanie. That was great insight. I've used the app a lot. And so one of the things I would recommend that you all do is, once you finish this, if you have an interest in using it, and I think you should, is create an account and use Stroke Journey and go in and play with it. There's lots of different parts of the app, and it's pretty intuitive. But until you get in there and mess with it just a little bit, it's harder to explain it to a patient or a family. So I'll go to the next slide. So we did beta testing over the last year. We did it at 7 hospitals in a variety of markets, different size hospitals, Nevada, Colorado, Tennessee, and Florida, just to kind of see what we would learn before we released it out to everyone else. So there's been a lot of changes that have come with the app, a lot of troubleshooting, and I think it's really at a good place now. We've had about 150 plus patients and caregivers use this version of the tool. And so I think you guys are going to find that we've gotten a lot of the bugs out, not all of them though. So like Stephanie said, there's that email. If you find a bug when you start using the app, please let us know and we can go in and adjust things. Let's go forward a slide. So I thought I would share some of the insights that we've learned from the beta testing over this last year. So there's obviously no absolute perfect way to do this, and we all work in different size hospitals and different communities, and we have different resources. And so I would think the most important thing is really having a plan for how you're going to approach patients and their families to disseminate this information. And then if you have a champion, that is much better, because that person can help share information to colleagues and others around the hospital or the clinic. It doesn't have to be done in the hospital. It can be done in the outpatient clinic. We think the earlier patients introduced to this, the more benefit they can potentially receive. So as early as possible would be great. So if we set goals and accountability, I think that helps us in almost anything, and this is no exception. So if you set a recruitment goal, for maybe 5 patients when you're starting out, and then figure out, okay, we didn't get 5 patients. Why was that? Was it that we didn't have 5 patients with a stroke over the last week, or was there some step in the process we could have made a little better? Make the ask during downtimes during the patient stay. So one of the things that, I find is the patient sits around for 8 hours a day in the hospital, not really doing anything. They may not be having PT or occupational therapy or doing tests. But then at discharge, all of this information starts coming in. So I think discharge is the worst time to do it personally. If that's the only time you have available to introduce it to the patient, then maybe that's when it is. But if you can find a way to have some member of your team introduce this when the patients are otherwise having downtime, I think it's much more receptive. And if you can find a time when the patient's family members there, it's also more valuable. Our stroke patients have varying levels of cognitive dysfunction. And so if it's a patient especially who has is more likely to not recall what we're talking about, or maybe have some processing issues early on, it's going to be even more important to have a family member. And as we know, family members are more likely to be there in the evening hours for most patients. So maybe think about having some staff in your evening hours, if available, to introduce this. And then we really think this works better if you involve the whole team. So the neurologist, if there's a cardiologist involved, the nurses, the rehab staff, dietary even. I mean, there's no reason you can't involve everybody on the team to really encourage the patients to think about this tool. Because again, at the end of the day, this tool is really a valuable source of information and education for our patients. We already talked about the family member. You know, if the patient's older and has more significant deficits, especially early on, the family caregiver can enroll in the tool instead of the patient. And then that way they can still get access to the same information. They can record any data that needs to be recorded in there. Like there's the option to record blood pressure and heart rate. There's the option to put in glucose levels and labs. And so someone else could do that for the individual that's affected by stroke. And then consider how you can enroll patients after discharge. We all know there's a lot of things that happen in the hospital. People are overwhelmed. There's a lot of moving parts, especially for somebody who's suffering a first stroke. And so maybe if you're doing your post-stroke follow-up phone calls, maybe a good time. If you have stroke support group meetings, that would also be a great time. Or if somebody's coming back to clinic to see us in the stroke clinic, or if they have a therapy plan, maybe even introducing as part of therapy. So again, lots of good tools and education inside this app that will help our patients over time. We can go forward a slide. So we are requesting you to help us and to really be a champion for enrolling your stroke patients and getting them the information about using this tool to help them. So we think there's lots of reasons to collaborate. You know, the first one is because it's the right thing for the patient. We happen to be meeting the patients at the time of their greatest need. They've just come in the hospital. For most of our patients, this may be a first diagnosis. They're, you know, overwhelmed. We know in the hospital people don't retain education for a variety of reasons, not just the effects of the stroke itself, but people are sleep deprived. They get a lot of information at one time. And so really being able to repeat whatever education they got in the hospital, and then really working on prevention strategies so that we don't become one of those one of those individuals that comes back with a recurrent stroke. So that's really the first reason we should be doing it. And so we can do it now. Stephanie went through really a good way how to download the app, how to talk to patients about enrolling in the app. And then, you know, one of the things I think works well is if you have a few people that really are experts in the app, and by experts that logged in and you're kind of familiar with how the app works. And if that's the case, you can then really go in and help patients and troubleshoot it. And you can say, oh, you know, you can show them some of the cool functions on the app, like Stephanie was mentioning earlier, but if they utilize the blood pressure tool, they can actually go in and before you come to a visit, you can actually print out the blood pressure. Not only does it have blood pressure, it may have how you're feeling that day, what kind of education the individual's completed, and lots of other information that's in there. And again, it doesn't have to necessarily be a nurse. It can be, you know, volunteers. If you have volunteers at the hospital, especially if they're younger and like tech, this may be a great person to utilize. Nurses obviously are capable of doing this, but our therapy staff, you know, clerical staff can do it as well. It's really anybody that's interested and wants to take the time to learn the app and talk to people about it. And then there's a demo video that's also helpful. We're not going to show the video here, but I'll tell you where the link is that you can look at. And you can actually, that's not a bad idea to have that on like an Apple or an iPad, or a phone's maybe a little bit too small for people to see, but an iPad or a computer in the room, and you can actually show the patient and their caregiver the demo of the tool so they get some idea of what it looks like. And really remember, you have flexibility around how you do enrollment. Again, this is a tool to help patients and their caregivers to hopefully get more education about stroke, about how to prevent a stroke, and then how to improve the care that they receive by documenting blood pressures and heart rates and other things that may impact their care. And so whatever time you get a patient to enroll is really the right time, and it's going to be different for every place. Again, I would caution you just a little bit, if you could, about waiting to discharge, because that does seem to be the busiest time, and I think people are a little overwhelmed then. So all of this information is at the Stroke Journey webpage, and that's stroke.org/stroke helper. And you can see all of these things. It goes through the app. There's education that's on here that you can see. That demo video I was talking about has a link right up here. You can register your hospital in there as well. There's a lot of things Stephanie was talking about, and it really walks you through it. It's pretty good. And if we go forward, next slide. You'll see our promotional materials are also there. These can be printed out and used in whatever way you'd like to. You know, maybe in the clinic, you could hang these on the back of the doors. And even if you forget to talk about it, most of our patients wait a few minutes in clinic. They can read about it and scan the barcode. A lot of us have those electronic boards in clinic now. So this is a great place. If you can add that to your electronic board, then you can go in there and show it to the patient from that standpoint. And you can put these in the hospital, the clinics, wherever you may be. And again, it's just another tool for your team to use to help show patients how to get this access. Then next slide. If you do want to use the demo video, this is kind of where it is, and this is what it looks like when you pull it up. And again, that's at stroke.org/stroke helper. And then we'll go forward another slide. And we've made some talking points that may help you and your team as you're addressing patients for the first time to talk about enrolling in the app. We kind of put a couple of different ones from the view of a neurologist, the view of a nurse, or the view of a rehab or therapy professional. I'm not going to read all of these off to you. They're going to be in your handouts. But, you know, what one may be if a neurologist goes in and says, you know, I have another prescription for you. I want to encourage you to sign up for the Stroke Helper app. This app gives you lots of helpful education that's going to help prevent a second stroke. And we would like for you to use this with your family member. And we really think this is a good tool and this will help support you in your stroke journey. Something as simple as that can really change the way patients view a tool like this. You know, in the cardiology world, cardiac rehab is one of the things that I think about. And the strongest predictor of whether a patient attends cardiac rehab is if their care team, their physician or nurse practitioner or PA tells the patient that it's important. And so we assume it'll be similar like that with these tools, these apps that we're talking about. You know, as a nurse, you may want to say, you know, I know that you're probably feeling pretty overwhelmed right now. You just had this stroke and that's new. This is very normal. It's understandable. You know, this simple and free tool that you can use on any smart device can give you lots of education and helpful information to help you not feel so overwhelmed. So again, some talking points that we found useful that I think you and your team may find useful as well. We'll go forward to the next slide. So we talked a lot about why you should want to use this app. The first, obviously, is we think it's a really great thing for patients and their caregivers to help in their recovery. But some other important points are it helps to meet Stroke Center certification requirement for patient education, which we all know is a great thing. We're all trying to figure out ways to, as hospital stays have become shorter and shorter, more ways to fit in education for our patients, especially for those that are at high risk of recurrent events. So this will qualify for that. This chat app that Stephanie mentioned is actually really nice because, again, I think there's so much education out there and a lot of it is not great quality education. So if a patient has a question, they can go straight to the chat app and it brings up validated information from the American Heart and American Stroke Association. And so it's a really good place to refer patients to look for good quality health information. It also can create connectedness with patients after discharge. So currently, if you enroll your hospital in the app, as Stephanie's already talked about, you'll be able to have access in the future to run a dashboard to where we can see like all the patients that were discharged from your hospital and enrolled in the app. You can see kind of what they're doing inside the app. Now, eventually the goal is to connect the patient data from the Stroke Helper app with getting with the Guideline Stroke on the back end, and we could pull up that 90-day patient follow-up data. Now, that doesn't exist today, but that is the plan and hopefully the goal before too long. So again, another reason to get our patients into this tool. And then it really does support and reinforce the work that the American Heart Association and HCA Healthcare is doing as part of Getting to the Heart of Stroke initiative. We think this is a really important initiative because we know that care is fragmented, and we think that bringing in the entire care team, which involves not only neurology but cardiology, to make an upfront diagnosis of what type of stroke it was, and then for patients who suffer from cryptogenic stroke or ones that we don't know the etiology, to looking into other areas that we should be looking into to make sure that there's not some other cause like an irregular rhythm, a cardiac abnormality that has predisposed the patient to a stroke, so that we can reduce the risk of future stroke. We'll go to the next slide. And I think that's all I had. So we'd be happy to answer any questions you have now. I'll have Stephanie and Russ probably come back on the app or on the webinar as well, so that we can all talk about any questions.
Well, thank you, Dr. Bailey, Stephanie, and Russ. This was a fantastic presentation. We are especially, heartened by your passion and commitment to make the path to recovery better for our stroke survivors. We have a lot of questions. I'll get started. Are there any alert flags for app users to call 911 or seek medical attention for things like extreme hypertension, severe depression, or new stroke symptoms?
We are currently working to add that functionality to the app. It's actually one of our highest priorities to add that in the next quarter of this year. So in the next 3 months or so, we are working to add that.
Okay, great. There's a couple, I'm going to put a couple of these questions together. They sort of run in the same realm. Can reports be run on the registration if the promoting facility wanted to know if the utilization would be of the app, or people who signed on to the app, would they be able to obtain that? And there's another question on the same realm that said, would they be able to see activity if a customer was being active on the app?
Yes. So another high priority for new functionality that we are actually already working to build is an administrative portal, if you will, administrative dashboard, where you as an individual hospital will be able to go onto the dashboard and see how many patients you've enrolled in the app, and you'll also be able to see their collective data.
Great. Looks like some of our listeners are already downloading the app. They're in there, and a lot of them are commenting, lots of kudos around it. Many questions about languages, different languages, a particular question around Spanish language or availability of even the handouts in alternative languages.
Yeah, great question. And we certainly recognize that the Hispanic Latino population is a very important one that we want to serve, and a growing population of stroke patients. It is part of our plan to create the app content into Spanish. It is not yet available now, but I would say it's part of our plan within the next year or so to have it available. One thing that and because it's not available in Spanish yet, we haven't made a flyer available in Spanish. In the interim, I do think there's an opportunity, perhaps to, maybe you're not enrolling the stroke survivor themselves who speaks Spanish, but, often they do have a family member who is bilingual or who is more comfortable with English as a language. And so maybe in that case, it's more appropriate to enroll that family member in the app instead. I do also want to take this opportunity to mention that we are working very hard at the American Stroke Association to increase the amount of educational resources we have available to our Hispanic, Latino, Spanish-speaking customers. And so I am super excited to share with you that in mid-September, we are going to be launching a fully transcreated version of our website. It will be derramecerebral.org, and we have spent the last year literally translating close to 300 pages of educational content, as well as infographics and fact sheets and all of our resources, videos into Spanish. And so that will be available to you as a resource for your Hispanic Latino patients and family members starting in mid-September. And that by doing that work, we have laid the groundwork for creating the Spanish version of Heart and Stroke Helper. Jeannie, what other questions do we have?
Can you hear me here? Can we add more than one condition as my health journey?
That is a great question. Currently, the answer is no. You have to choose a single condition. One thing that I will tell you, for example, is say you start out in the app as part of choosing stroke as your journey, and you go through the 13 weeks of that educational program. At the end of the 13-week stroke journey, if you will, you then at that point have the opportunity to choose a different condition. So if you want to choose self-managed blood pressure or cholesterol as your health journey, you have that opportunity at the end of the initial journey to do that, and then that will launch a whole new realm of educational content for that different journey. Whichever condition you choose, you're still able to use all of those basic functionalities that you saw on the home screen for, tracking vital signs, tracking symptoms, etc.
Stephanie, can I add, one of the things I forgot to say when I was talking about the benefits of the app is I really like the way the education kind of comes out gradually. So once you join the journey, it will send you updates every day with a little new piece of information on your educational journey. And so it's kind of nice because it's not overwhelming. It's very easy, sort of bite-sized nuggets of information that we can pick up on.
Yeah, that's a great point, Dr. Bailey. And I will say the education is also available in different formats too. So it might just be a 1 or 2 sentence message. It could be a link to a video or a link to a fact sheet or another resource of the ASA that we think would be valuable for that particular issue or question.
And the videos are really high quality. Oh, I'm sorry. I was going to say the videos are really high quality. Sometimes I think a picture really is worth 1,000 words, and a video is probably worth about 10,000. But when you show a patient what it looks like, that really a blood clot has gone to a vessel and lodged, and that's what a stroke is. I think that's really eye-opening because we don't necessarily think of it that way. So they're really good content.
And this sort of builds on that there are 3 different options: stroke, cholesterol, and blood pressure. Are all 3 included in the stroke option, or does the patient need to sign up for each module? So does the stroke selection cover blood pressure and cholesterol?
As part of the educational content for the stroke journey, we do have information about various different risk factors for stroke, including high cholesterol and high blood pressure. It also includes information about diabetes and how it increases risk for stroke, and the importance of managing those conditions. So they will receive some educational information, on all of the different stroke risk factors as part of choosing the stroke journey. And then, as I said, after they complete the stroke educational journey, if they want to go back and choose a different journey, choosing the cholesterol journey or the blood pressure journey would then just give them a more intensive focus on those particular topics.
There's 2 questions here concerning about hospital use, or 3 questions. So there's a question that, is it acceptable to have a link to the demo video to the hospital on the hospital webpage? Additionally, is there a cost to the hospital to have the hospital listed as Stephanie presented? And do they need to go through their legal department? Do they need to have this approved?
Yeah, all good questions. Yeah, you are welcome to have a link to the demo video on your hospital web page. We do have, ask that you attribute it to the American Stroke Association, and you can find website, the American Heart Association and American Stroke Association's website linking policy on our webpage, and we can drop that into the chat as well. But yes, please do. We want you to share the demo video and information about the tool with as many people as possible. Yes, the app is free for hospitals to register, and we would love to have you register as much as you can. And then in terms of whether you need to consult with your legal department, I think that's probably a question for your individual hospital. As far as we're concerned, that's not necessary, but you should perhaps consult with your supervisors to determine whether you think that's necessary.
There's a question, will the stroke signs and symptoms be FAST or BFAST, as most hospitals are using BFAST now, and consistency in messaging is helpful, and the same, will Rapido be incorporated?
I am shocked that that question comes up. I never get asked that question. No, I'm just kidding. Right now, the information on stroke warning signs does highlight FAST as the acronym that the American Stroke Association uses. Although we do, as part of our education, also try to highlight that there are other symptoms of stroke not incorporated into FAST, and so include that at education as well. This is probably a great time to mention that the American Stroke Association has conducting research currently among the general public, among general consumers, where we've randomized participants into a trial where we are evaluating the effectiveness of FAST compared to BFAST in terms of their ability to retain the warning signs of stroke, as well as which one is more motivating in terms of encouraging them to call 911. So that research is underway. We are going to be disseminating the results of that research, and we are planning to submit an abstract for publication, as well as a abstract for the International Stroke Conference. So stay tuned for the results of the findings of that research.
There's a question on who sees the patient's data on the back end, if anyone?
Yeah, good question. On an individual basis, the only person who sees that individual data is the patient or the family member themselves. The American Heart Association and American Stroke Association only sees aggregated information. And likewise, once the administrative portal is available to you as hospitals, you will also only be able to see aggregated patient data for your patients. So nobody is seeing individual patient data other than the patient themselves. Of course, if the patient does choose to print out that PDF report that both Dr. Bailey and I talked about, and then it shares that with their healthcare provider, then of course that's their choice to do that.
Okay, there's another question, and it says I might have missed this. Do we have qualitative information from sites and or patients to help support the use of this at this time?
It is, I mean, I think that as I said, and Dr. Bailey, you can feel free to jump in as well. We have, spent the last year beta testing the tool. And so I think a lot of the feedback that we did have received is qualitative feedback, feedback on if they were experiencing bugs, or if there were, particular challenges that they had using parts of the app. So it has evolved a lot over the last year as we continued to improve it based on that qualitative feedback.
Yeah, and I would just add that the actual information contained within the app is all validated information that comes directly from the American Stroke Association or American Heart Association websites. So that data is quality data. There's also a lot of other useful tools in the app, like it reminds you to take your medicines, which I think is super helpful. So I don't know that there's a quality from like a validated sort of source, but I would tell you the people that use it, I think, like it and have found it to be a useful addition to the other things they're doing. And there is lots of quality data about patient self-monitoring and improving outcomes, especially in the realm of hypertension and glucose control, which are both important for recurrent stroke.
Here's a great question. So how does this align with meeting the goal for certification for education for patients?
Ginny, you might actually be one of the best people to answer that question. It's not a formal endorsement of the app by the Joint Commission or any of the other certifying bodies. I don't want to imply that that's the case, but just knowing that patient education is a certification requirement for stroke centers, we do believe that this tool is a new and innovative way that you can meet that education requirement. Anything that you would add,
Our
Jeannie?
goals of education are to learn how the patient learns, right? And best meet their needs. So I think this is another option that would demonstrate to your certifying bodies that you are really addressing that individual patient need. A lot of the people saying they are looking forward to your Spanish translation of the website. How do hospitals enroll? How do they enroll their hospital system in the app? Do they need to reach out to you, or can that happen independently on their end?
So there is a link on our Stroke Helper webpage. So again, that's stroke.org/stroke helper. And in the middle of the page, you'll see a box that says hospital registration, and just click on that link, and it asks you, I think, 4 questions. It will ask you your health system name, your hospital name. It will ask you for a contact. You can decide who the most appropriate contact is for your particular hospital. And then it also asks you your hospital location. So very simple registration process.
This is why I love talking to nurses, because they think of stuff that I didn't think of. But is there an option for the app to talk to someone who is blind?
Yeah, that is a great question. I don't believe so. Having said that, I'm going to take that question back to our vendor, and I may follow up with you on that. We do work to make sure that our app meets all of the accessibility requirements. I'm not a technology expert, but there's this process called WCAG, that's the accessibility guidelines. And so I can tell you that the app has gone through extensive usability testing, and it does meet those WCAG guidelines, but I don't know that there is an ability for it to speak out loud. Having said that, maybe that your phone itself has that capability, but I just don't know enough.
I was thinking the very same thing, Stephanie. It might not be as complicated as changing the app, but using some already available resources. But a very good question. Here's a good question, and I might be able to answer that. Is there a general timeline for app integration linkage with 90-day follow-up form, or is there too far out? We currently are not linked to the 90-day follow-up form. If your question is there ever a patient who is too far out of their stroke to get on the app? Absolutely not. We know that stroke recovery doesn't end. It goes on and on. We see a lot of it within the first 90 days to 6 months, but stroke recovery goes on and on and on, and it's never too late for secondary prevention and education.
Yeah, and I think maybe, Jeannie, the question is like, what is the timeline for back-end integration with Get With The Guidelines? And that is part of our long-term plan and goal for the app, but it's actually too early to give you a timeline. As you can imagine, that's a pretty significant undertaking. So it's not in the next year's plan. I'll say that.
Okay. This is a good question. Probably we don't have this answer yet, but have you appreciated a lower readmission rate with patient use of the app?
That's a great question. And so as you surmised, we don't actually have that data yet, but it is we have developed a robust evaluation plan as we enroll more and more patients in the app. That is one of the metrics that we are interested in tracking. Of course, it will be based on patient-reported information, but yeah, that would be very valuable. And so we do hope to be able to have that kind of information available in the future.
Are there resources identified in the app for medical issues? Things like different alternative resources to stop smoking or to seek out support groups?
Yeah, so depending on the topic, we do refer people to other resources. I mean, for the most part, we want to make sure that any information we're sharing is evidence-based and verifiable information. So a lot of those educational topics, we are relying on either, American Stroke Association or American Heart Association information. In terms of support, we do make available information about a lot of the different tools that we have available. So for example, if they're looking for a stroke support group and there is information built into the educational journey about the value of a stroke support group, and it includes a link to the stroke support group finder tool that's on the ASA's website. So that would be a way of referring them to local stroke support groups, as well as to our 1-800 number, our stroke warm line, that's staffed by trained stroke specialists. So we do include that kind of information as well, but for the most part, it is AHA or ASA information.
Okay, great. I think we have time for one more question. Is there anything about Life's Essential 8 included in this app, as that seems fundamental concept info important to all health conditions?
Absolutely. There is most definitely information about Life's Essential 8 in the app.
Okay.
Part of the stroke educational journey.
Well, thank you so much for your participation. Thank you to our passionate your input today. Don't forget that we will be sending out the recording that you will be able to access and share and review. So thank you for attending today. We appreciate you, and so does your community appreciates your care that you give on the front line. Thank you so much. Take care, everyone.
Thank you all. Bye-bye.
Thank you.
Thanks.